Male pelvic pain, is it prostatitis or is it pelvic floor? Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Male pelvic floor or male pelvic pain is so common, and yet there's so many pelvic floor therapists who don't really like treating male patients for multiple reasons we're not going to get into. When it comes to pelvic pain in men, the first assumption that's typically made is we want to rule out STDs or STIs, sexually transmitted infections. And then is it a urinary tract infection? And so there's a lot of antibiotics or a lot of testings that are done. And no matter what, and this is the irony of it, is even the tests come back negative, there's still antibiotics that's given to the individual. So this lingers the problem, and the individual, essentially, men typically don't address a problem unless it involves the penis. So this means that problem has been going on for quite a while now. By the time the individual actually goes to a doctor, then there is that whole process of doing this test and doing that test and still not really addressing the problem. Of course, we want to rule out all the infections, but that's not where majority of the issues come from. The next thing that happens is you're referred to a pelvic floor therapist. Typically what ends up happening is the pelvic floor therapist gives you a few exercises. They most likely go through the anus, try to access the muscles on the inside, and try to loosen up some of these things in the attempt to lower the level of pain or hopefully make the pain go away. The problem there is, take a look at your index finger and see how far that's gonna go. And what ends up happening, what if it's not right here and it's a little bit farther and your finger cannot reach? Now what? So the reason I'm doing this video is because from my perspective and what makes sense to me, I want to stabilize the house that pelvic floor is the floor of. The muscles inside your pelvis don't just randomly work against you. Something is setting that off, and that something is instability, because they are created to work with the outside to stabilize the pelvis, because your pelvis is a foundation to the structures above. Without a strong foundation, the structures above are at jeopardy. The structures above is who you are. Without your arms and legs, you get to live. Without your trunk, you don't. That's just what it boils down to. So I want to go after what's causing instability here. I want to address the things that are feeding the problem. For the sake of this video, we're discussing the difference between prostatitis and pelvic floor. Not the difference, but looking into the two. Inside of your pelvis, in the front, is your bladder. Next to it is your prostate, and in the back is the intestine. So your prostate is sandwiched between your bladder and your intestine. When there are issues with the inside, and let's say you have to, it's just like the muscles are tight, let's say. The space where these three things are squished is smaller. Your options are to empty the bladder more frequently, or go to the bathroom more frequently for number 2, bowel movement. Your prostate is sitting in the center getting squished. So these are like the initial steps. Typically starts with urinary presentation, which may not register in you because it's not loud and slap in the face. It may turn into constipation later on, which is not killing you, so ignore. But when it involves the function of the penis, the function of the sexual function, now men are like, I need help. So that's when they go in, and urologists typically look at it and say, oh, you've got prostatitis, inflammation of the prostate. And you're looking at the individual, this is a young person in their 20s. So it doesn't even fit the bill, based on the criteria that typically would prostatitis would be attached to, the age that I'm referring to, which is not age related. So when it comes to pelvic pain, I want to take away the reason why the muscles on the inside are tight, making the structures inside being squished malfunction. functioning in one way or another. I'm like putting it in a very, very simple term. So how do we go about fixing that? In the absence of infection and other medical conditions, by the way, nerve irritation is not one of those medical conditions, because nerve irritation, you got to understand why is that nerve irritated, and very quickly you realize it's because of the instability of the spine or the pelvis, depending on where that nerve is. So while we address that nerve irritation with proper treatment, we do need to still stabilize the pelvis. So when it comes to stability of the pelvis, I follow developmental movements. That means the same movements, once again, that got you from helpless infant stage where you could barely hold your head up to become a running toddler's. No weights, no bands, no nothing, no guidance. You are hardwired to do it this way. So why am I reinventing the wheel? Why am I coming up with isolated exercises when movement is a concert where every musician plays their part? Either they are the main players with the spotlight on the main player and the rest are background musicians, or whatever the case may be. Bottom line here is we cannot isolate an area and try to stretch or strengthen it. It doesn't work that way, because that area is responding to everything else that's happening or not happening enough. So we need to address this holistically, yes. That means you do need to understand what right looks like, what your version looks like, and how to replace yours with the right. That means the day of you taking your body to someone and having them fix it should be long gone, because I bet you anything you've got other things to do, better things to do than to provide or hop from one provider to the next and not knowing what's going on. When you provide the authentic, right environment for your body parts, they do thrive, because they are given to you to make you last a long, long life. They know exactly what their parts are. They're just not in their environment. Provide the right environment, provide the right breathing, provide the right stability. They know what to do. I know it makes common sense. It's so simple, and yet there's so many people with pelvic floor dysfunction, men and women. If this makes sense, please comment and say makes sense. If it doesn't make sense, please comment and tell me what part of it didn't make sense. If you have not subscribed to my channel, make sure you do. This is when I get to not worry about the timeline and explain things more in detail. If you're in trouble and you need help, but you want to understand how to be instead of here's my body, fix me, contact my office. I'd love to see what's going on. Until next time, take care.